So Kevin, tell me about your knees before we did the stem cell procedure. What symptoms were you having?
Pain-wise, it was basically I couldn't do anything. I could walk, but I walked with a severe limp. Your everyday activities, getting out of bed, taking showers, just moving it, period, was a job in itself. Being self-employed, it really slowed me down from doing my everyday functions. So I just managed with the pain, which was intense at times. Sometimes I get stuck in a kneeling position, I couldn't straighten it. Sometimes I get stuck in a straight position, I couldn't bend it. But nevertheless, it was intense.
Mm-hmm. Do you know of any specific injuries you had that caused your knee pain?
Well, this all started when I was in the Marine Corps. Back then they call it patellofemoral syndrome. From there, it just escalated from my job and everything else that I've done to show that basically that's where it started at. But the injury, to my knowledge, was known just as patellofemoral syndrome. I just lived with it as that.
Before we did the procedure, how long were you hurting to the level that you just explained?
Probably about 6 months.
Okay, so before that 6 months, were you just kind of milder pain, or were you pain-free before that 6 months?
It was mild. It just came and go. It was certain things. It would always pop out a joint, but I'd always have it. It would be pretty much a week or two, and I'd be back to normal after it would pop out of a socket or out of a joint. And then this time it just didn't. And a month went by, 2 months went by, and then it just started to hurt more and more and more until you fixed it.
Okay. What specific things did you want to do but couldn't do because of your knee pain?
I couldn't bend down. I couldn't get up. I couldn't jump. I couldn't run. I couldn't play basketball with my son. I couldn't do any sports activities. Couldn't ride a bicycle. I walked with a severe limp. It was very. Everybody noticed it, and everybody questioned me about it. So.
Kevin, what problems did you have with your knee? I know we did an MRI. Can you tell us a little bit about what the MRI showed?
Well, I knew that it was torn. I had figured that it was torn. The MRI showed that it was the MCL, ACL, and I think there was one more ligament that was torn. There wasn't really much left from what I remember the MRI showing.
Okay. And what expectations did you have from the procedure? Before we did the procedure, what did you think you would experience in the months to come after the procedure?
I figured that inevitably I was going to have to get a total knee replacement. I didn't think that this was going to work. I didn't think that I was ever going to be able to walk normal again or play ball with my son, and that was the scary part, is that I wanted to spend time with my son and be able to do things that normal dads do with their kids. So.
Okay. What other treatment options did you try before we did the procedure?
I tried braces. I had, I can't remember the name of the brace, but it was a $700 brace, and I had that put on, and I used it on a regular basis. It restricted me to the point where I could walk, but that was pretty much just about it. And it caused, I believe, just as much pain. It didn't help me on the pain sense at all, because I think it actually caused me more pain.
Had you ever heard of stem cells before I talked to you about stem cells?
No, I have not.
Did you wear the brace after the procedure? Did you need to continue wearing the brace? Or are you still wearing the brace?
I was instructed to wear the brace, but like I said beforehand, as I started feeling better, I couldn't. It seemed like it restricted me, and it actually caused me going back into the past of having more pain once again. So I was just kind of experimenting to see what worked better, and I'm definitely not as confident as I was back in my younger days, but ultimately I stopped wearing the brace just because of pain.
So before we get into how well you did, tell me a little bit about the procedure, what you experienced during the procedure, and which procedure you did.
Okay, I believe it was the PRP.
Right.
And they had where they took fatty tissue from my stomach, which there was plenty, and they mixed it in a machine with my blood, and then they injected it into my joints. And they did the left and the right, and both wrists. So the procedure was pretty quick. I mean, it wasn't really that painful for the most part. But ultimately, I knew that both knees, this was a chance that I was willing to take to see what happens.
So there was inevitably some pain in the procedure, but you felt like it was bearable and we made it as comfortable as possible.
Absolutely. I mean, for the extent of pain that I was already in, and for what I actually went through was minimal.
Okay. And you're a Marine. Thank you for serving our country. And so, do you feel like this would be a reasonable procedure for someone who is not a Marine to go under?
Absolutely.
Okay. All right. And about how long did the procedure take, if you remember?
The actual procedure all in itself, from taking fatty tissue to mixing the blood and all that, I want to say it was right around an hour.
Okay, perfect. And so tell me a little bit about what you felt that night of the procedure and kind of the days afterwards. Did you feel good? Did you feel worse? What hurt the most?
I mean, I had both wrists done, both knees done, and I drove home. It was an hour drive. So I did everything the normal ways that I mean, the pain, for the most part, from my left to my right, obviously my right increased. So I was kind of on the same boat with both knees now. And
to be more specific, the right knee was the worst one?
The right knee was the worst pain after the procedure. It did hurt quite a bit more, and that was the better of the two knees pain-wise.
Before the procedure?
Before the procedure. But it did increase. The pain did increase.
For about how long?
Right at 2 months. What do you think, Doc?
And then what happened at 2 months?
It was really weird because it was like one day, I mean, literally I had to get help to get up from a kneeling position, or I had to find a brace or something to help me pick myself up off the floor. And one day I just kneeled down like I normally did, and I didn't need help. And then I realized, I was like, wow, I don't need help to get up from a kneeling position. And I actually showed the doctor the next day. I was like, check this out. And I was jumping up and down, and he was like, whoa, kind of slow down a little bit. But ultimately, I was really impressed on what perspired in 2 months. I mean, because I'd been suffering for, at that point, it was over 6 months at that time that I was actually suffering for.
Okay. And so the procedure was how long ago now?
It was in October.
Okay. And so that was obviously in December. So how have you felt since December? It's currently May 18th, 2016.
I mean, for the most part, he told me not to run, but I ran a mile and I hadn't ran in 2 years since all this has happened. And I ran a 9-minute mile. So, I mean, it's usually my mile and a half time, but nevertheless, just the fact that I can run again is I never thought I was going to run again at all. I didn't think I was going to walk right again. My dad's had both knees completely reconstructed, artificial, and I thought I was going to be in the same boat as him, and I didn't want to be in that boat, not yet. So just the fact that I can actually play basketball with my son and do normal activities with minimal to no pain is pretty cool.
So how would you rate your pain level on a typical week? Would you say a 0 being no pain, a 10 being a lot of pain?
I mean, I might get a spurt here and there, and we're talking maybe once a month. Sometimes I might get one a week, but I won't get another one for a while. But ultimately, it's pretty much a 1 to a 0.
Excellent. And what activities would you like to do now that you can't do maybe because of the knees?
I think it's just a confidence thing now. I'm starting to strengthen my knees, getting back to the squatting, the leg press, leg extensions, running, but I'm still going to kind of be easy on the running because I know that the damage there is inevitable, that there's just some things that aren't going to be like I was 20 years ago, of course. So I'm not going to push it, but for the most part, I can do pretty much anything that I want.
Great. Is there anything you'd like to tell others who may be considering this procedure, warn them about, or encourage them? Anything you have to tell someone else who is suffering like you did?
I mean, even if your pain level was near mine, which I was at a 10 when I was going into place. I mean, there was times where I was literally on the ground just wanting to cut my knee off. I mean, I literally, and with no joking, I literally sat down one day and just thought about, if I just cut my leg off, I'll just cut it off and it won't hurt anymore. And take a chance, because ultimately this saved me a lot to be able to do what I do now, because ultimately they saved my life, because the pain was that bad.
Thank you for your time, Kevin. Thank you for being honest. Thank you for serving our country. We appreciate everything you did.
Thank you.
You're welcome. So, Kevin, you've done your knees now in October, and it's May now, so about 7-8 months ago. And today you're here, and we just did PRP on your elbow. Would you like to tell me a little bit about why you chose to do another treatment, and what you were suffering from, and what you're expecting to get out of this treatment?
Well, I'd had the knees done in October, and with the, with what I've got out of it, it's pure miracle in my mind. So I was like, elbow's been bothering me now about 4 months, 3 months, somewhere around there. And it's not as bad, of course, on my knees because I don't have to walk on my elbow, but ultimately I use my right arm on a daily basis. Mm-hmm. I wake up with constant pain. Just stretching it out in the morning is very painful. So I figured, well, if it worked on my knees, let's see what happens with the elbow.
Okay. Can you point to the pain for the camera and for everyone? Can you show us where you were hurting?
Well, there's some black there for you to see there, and then there's some more here.
Okay. And what symptoms do you have on a daily basis?
It's a throbbing pain, it's a shooting pain, a mixture of both, because there'll be something that I just do, that, like picking up a bottle of water that you take for granted, and then it just, I've literally can drop stuff because it hurts so bad. I just brushed the door this morning, just coming here, and literally I was just like, oh my God. I mean, it almost feels like a broken bone. Okay. Is what it feels like.
And what procedure did you have done today?
Today was the PRP.
Mm-hmm. And we did not do any liposuction?
No liposuction.
Okay. And so how was the procedure? Very painful, mildly painful, tolerable?
It's tolerable.
Okay. Good. And how do you feel now? Is the pain better or worse than
stiff.
You came in?
It's stiff. It's sore. It feels like I did a workout now. Mm-hmm. It feels bruised. But for the most part, it's still numb from the numbing medicine he gave me. Okay. But ultimately, this is what I expected.
Do you feel like you could drive home with that arm?
Oh, absolutely.
Okay. Excellent. All right. Thank you for being honest. Okay.
Arm feels better, just let you know.